Hello, everyone. Welcome to the second installment of our webinar series, a part one and a teaser of Mastering Treatment Planning with Dr. Tania. So we're all thrilled to have you here as we dive deeper into the world of treatment planning, featuring the expertise of Dr. Tania to explore the art of clinical design and workflow optimizations. For those that don't know me, I'm Rosa, and I'm the digital product manager of the Xflow workflow management platform, and I'll be your host today. So today we will start embarking on a journey of empowerment, where you'll get to gain insights into mastering treatment planning yourself, whilst also exploring the option of outsourcing, because in the ever-evolving landscape of orthodontics, taking control of treatment planning helps you in achieving optimal patient outcomes. I will then hand over to our guest speaker, Dr. Tania, a professional in the field of dentistry, renowned for her expertise in treatment planning. Throughout this webinar, Dr. Tania will share invaluable insights, practical strategies, and demonstrate how you can take control of your treatment planning processes. I will then jump in and then talk about the role of artificial intelligence in retainer designs, and showcase how technologies such as the workflow management platform like Xflow, coupled with a CAD software such as Vision, can help streamline your treatment planning workflow. Now, if you look at your Zoom window, there should be a Q&A section and a chat that should appear. If you have any questions during the presentation and the webinar, please feel free to send your questions through in that little chat window. And I will have a look at that, and we have a Q&A segment at the end where we can address all the questions that you may have. So let's just get started. Before I hand over to Dr. Tania, I will be discussing two primary approaches to treatment planning for clear aligners: outsourcing versus in-house planning. Now, each method has its own benefits and considerations, and finding the right balance between them can optimize patient care and practice efficiency. Now, let's begin with outsourcing. So this approach involves relying on external specialists or treatment planning companies to design your clear aligner treatments, especially when you have cases requiring extensive tooth movement, complex bite alignment issues, and patients with unique dental conditions. Now, the benefits of outsourcing usually includes being able to leverage the expertise and experience of those who are specialists, just like Dr. Tania, reduce burden on your own capacity and in-house resources and staff, ability to handle complex cases efficiently, and also access to advanced technology and specialized expertise. Now, when we start looking at in-house planning, this method involves leveraging your internal expertise and resources to design clear aligner treatments yourself. Usually, we see a lot of our clients use in-house planning for routine cases of mild misalignment or minor crowding, and patients with straightforward treatment needs that you can easily fix yourself. Now, there are a lot of benefits of in-house planning, such as being able to have complete control over the whole treatment process, being able to customize it based on your patient preferences and their history, and then having that continuity of care as they come back and have changes or are not fitted well because they haven't been wearing their aligners, for example. And lastly, of course, cost savings and professional development for yourself. Now, ultimately, the goal here is that we find what we find a lot of our doctors prefer to do is to find a flexible hybrid approach to balancing the benefits of outsourcing versus in-house planning. Like, which way do you normally choose? So for routine cases and cases within your expertise, you can handle treatment planning in-house to maintain the control and continuity of care. And then for complex cases requiring specialized expertise, you can leverage outsourcing to ensure accurate and effective treatment outcomes. And by adopting this hybrid model, you can optimize your treatment planning process and open up the ability to be able to be flexible enough to adapt to varying case complexities, to be able to optimize and work with the different resources and expertises you have in-house. You can mitigate the risks associated with unfamiliar cases and improve patient satisfaction. So in being able to choose between outsourcing and doing it yourself for clear aligners, it depends on the complexity of each case and the resources available to you. By integrating both of these approaches into a hybrid model, we can deliver optimal care and ensure the best outcomes for your patients and your customers. Now, through talking to a lot of our doctors out there, we come across some hesitation to evolving the clear aligner planning process in-house. Firstly, we're all time poor. Doctors want to see their patients. You want to focus on the best care for them. Labs are constantly doing the manufacturing and taking care of the workflow there and the processes. But on top of all of that, there's so many softwares and so many aligner companies that it probably feels too hard of a task to undertake. So how does one take a leap like this? And this is where Dental Access can help. With 12 years in this industry globally, we have seen practices and labs of so many different scales and sizes. This is how we usually help our clients gain the confidence and move into doing it themselves in a way that would be most cost-effective and efficient for their own needs. So the first step in this type of transition journey is to start with strategic outsourcing. Now, this involves shifting towards lower cost, high quality outsourcing partners with reduced risk. This reduces initial investment for you and provides you with opportunity to assess outsourcing partners for long-term collaboration. Now, once you feel comfortable with assessing plans, you may want to consider leveling up your capabilities to design yourself. Especially for some of the simple cases, we provide training and advanced treatment planning techniques. We can help you invest in essential tools and equipment for in-house clear aligner treatment. And depending on your needs, we'll set it up in a way that can benefit you. And as you progress, it's essential to take control and consider implementing advanced treatment planning software tailored to your practice's needs. So establishing efficient workflows for streamlined case management, leveraging AI solutions for designing clear aligners or retainers. And then finally, we'll focus on scaling and optimizing your practice for sustainable growth. From here, we can continuously help you evaluate and refine your workflows to help maximize productivity and help you invest in automation and technology to reduce your operational costs. This approach empowers you to deliver exceptional orthodontic care whilst optimizing efficiency and patient outcomes. We know it works because our clients who start this journey with us has never taken a step back because there's just literally so many benefits to be realized here. So with a wealth of experience and a passion for treatment planning, Dr. Tania has partnered up with Dental Access and is dedicated to empowering dental professionals like you to excel in treatment planning. And without further ado, let's delve into the world of treatment planning mastery and discover the possibilities with Dr. Tania. Over to you, Dr. Tania.
Hello, everyone. Thank you so much for joining today's seminar. We are going to, well, first I want to introduce myself. Thank you, Rosa, for the introduction. I am an orthodontic with more than 12 years of experience in dentistry. And also I have a master's degree on clearaligners therapy to understand better the protocols, movements. Also, I have more than 4 years of experience working with clear aligners company like Align Technologies, My Direct Lab, Spark. All these companies brings different type of protocols or ways to work, and also work with orthodontics around the world has bring me like a lot of new information on how the clear aligners work and how is the best way to provide them great outcomes or great results to our patients. I have been also working, leading or providing seminars and trainings to doctors around the world. It also has been great because when I started study, I never imagined that I had been the chance to work with so many different people's cultures and also learn from them in the whole process. And also I because of all this experience, I have been working with different type of softwares. Um, and understanding the limitation of the softwares can have, and also experiences amazing result with different type of softwares, such the one that we are going to review today, which is vision software. First, we are going to take a look on the art of clinical design. So we are going to review some techniques and touch ground in biomechanics, and so basic knowledge that we need to understand first to have good outcomes and good results. To start, we all know the foundation. We need to understand the foundation of a successful clinical design. In general, this is like first, the importance of a comprehensive assessment. Take a look in all the details of your patient, like clinical history, all the things that the patient can bring, all the information that the patient have, even family clinical history. It's very important to take a look in the whole world of the patient to understand what they need. Then we have the understanding the patient-specific factor like bone condition, a skeletal condition in general. It's going to bring a lot of information, everything in a specific way of what we have in the patient, and then we can consider interdisciplinary perspective. This is very important because we need to work with a team because we are working with a human that is not only need that the teeth move. So we need to work with a periodontal team, with a orthodontic team, with a aesthetic team, work with all the team together to bring the best results to our patient and achieve the goals. Then we need to do the treatment plan based on what the patient needs. So patient-centered approach, working and provide a treatment plan that adjusts on the patient's needs. And also understand the evolving nature of a treatment planning, the fact that the treatment plan can change during the process because it can happen that sometimes the teeth doesn't move as we expect. So we need to reevaluate the treatment plan, make refinements, change attachments, everything that we need to do to achieve the correct results, even if we need to change it during the process or have a refinement or modification. One of the important things here is the fact that we can have all in one place, like all this information, all the refinement cases, all the patient information in just one place to avoid a confusions or delays or like having a good documentation of our process. Now we are going to see some biomechanics behind clearaligners. So it's very important to understand how the teeth moves. That is why on our basic or in this seminar, it is very important to have this knowledge first, because at the end, we are going to have an orthodontic treatment plan. We are going to move the teeth. We are going to change the patient bite. So because of that, we need to understand how they work, how the liner works, and how the teeth move. So if we divide it on how the aligners move the teeth, we can divide it on two categories. The first one is displacement driven system, which is the one that was first invented. And it's basically that the aligner have a shape and the teeth need to fit into that shape. That is how the teeth move. The teeth trying to fit into aligners. And with days, they are going to start to move. The situation with this type of biomechanics is the lack of complexity. I mean, we cannot create complex movement because the teeth are not going to move. Let's say, for example, like extrusion, big rotations, or tops, torques or tips that are insignificant. Because at some point, the tooth is going to stop tracking and they cannot move, just try to adapt to the aligner shape. Because of this, the force-driven system was invented. And it's basically that the aligner have a pressure point. That means the aligner will move the teeth, creating pressure in some areas. This, with attachment, give us the chance to create more complex movement, like big rotations or significant torque, extrusion, for example. So this opens more the complexity of the cases because the teeth is not need to move to fit into the aligner. The aligner will make the movement, creating pressures in a specific areas. Now we can see how we was talking about the pressure points and created the pressure, but I want to compare the biomechanic with aligners and brackets and wires of regular orthodontic. So we can see in the first image, in the image that is in the up side, in this part we can see that the aligner create pressures. That means they push the teeth to get into the correct position. The difference is the brackets and wires pull the teeth. That means they have an external device, which is the wire. This wire have a memory, and when we put it into the patient's or add it to the patient's teeth, the wire is going to pull the teeth into correct position. Trying the wire, the arch, is going to look for the correct arch form because it has a memory, so it's going to move back again, moving the teeth or pulling the teeth into correct position. The aligners do not have that option because we don't have an external wire to move the teeth. That means the aligners have to push the teeth into correct position. When we are doing expansion, they are pushing. When we are doing rotation, they are pushing in different positions to make those movements to happen. So it is very important to have the correct point of pressure to create that movement, and also to have the correct attachments and the correct amount of attachments also to have that movement happening. We are going to go more deep in that later on the presentation. But I want to show you the difference when we are working with these two type of therapies. And if we talk about forces, the aligner have or create a force of 80 to 90 grams by aligner, which is more forces than the brackets and wires do. That means the treatment plan can be reduced. Then we have movement that is 0.25 millimeters by aligner. If we do more than that, if we try to move at it more than 0.25 millimeters by aligner, we can affect the periodontal ligament and the bone. And then we have 1 to 2 degrees of rotation or the degrees movement, which is torque, rotation, or tipping. We can achieve 2 degrees is also a good amount to move by aligner. And 0.25 of torques, that is the same. Now we have the scope and limitation of treatment plan with clear aligners. This is also very important to understand at least the basic knowledge, because we need to see first if our patient qualify of a treatment plan. So the first thing that we need to evaluate is the X-ray, because we need to see if the bond, periodontal ligament, and all the internal into patient's mouth is good to proceed. if we don't have any pathology on the bone or any issue with the roots, short roots, or impacted tooth. So we need to take careful evaluation. This includes any therapy that you want to use for the patient. At the end, you're going to move the teeth. So to move it, we need to see, or we need to have a good criteria to have a good result. If we don't have a good bone condition or good periodontal ligament condition or short roots, at the end we can make this issue even bigger or make it more considered if we try to move it and don't have a correct criteria. Then we have the skeletal condition. So on the skeletal condition, it's also same for any orthodontic therapy. We need to see if brackets and wires and also aligners can move the teeth. They cannot change the skeletal part of the patient. This needs to be changed with the surgery. So if we are going to treat a patient with a very class 3 skeletal condition, we cannot say the patient, the bite is going to improve just moving the teeth. So we need to be very careful on the evaluation, or try to retract just to improve the bite. We need to be careful on what we can achieve and what we cannot, and explain the patient this need to be treated with the surgeon, not just with orthodontic process. Then we have a complex teeth position. This part is something need to be evaluated, because this is one of the most the example that happens the most, this ectopic tooth. If we have an ectopic tooth, and an aligner is just one unit, so the aligner cannot try to go all up to that canine, for example. That means we will need to make the treatment plan in 2 phases. First, it's going to move the teeth, open the space for that canine, but we will need to use an external device like a bottom and elastic to bring that canine into the arch shape. And when we have it, the aligner can cover it and move it. So that's going to be phase 2. That is why I place it on the scope of limitation, because we cannot just include it on the treatment plan from the beginning. That is going to make the treatment plan very complex. It's going to make it unpredictable, the extrusion process, and will probably create feeding issues and discomfort to the patient, because trying to make the plastic go so up in trying to achieve a good traction of that canine, it's very difficult. So we can treat this patient with clear aligners, but we need to advise the patient this can be done, but we need to use different techniques, not just clear aligners. Now we can review the attachments. So attachments is another thing that is very important on treatment plans. And we can see on your right is a treatment that was not treated with the correct attachments and the correct amount of attachments. The situation with attachments, or why they were invented, is the fact that they have an extra surface or extra, they are bonded into the tooth. It creates an extra surface where the forces can pass. So if you see the picture on the right, you are going to see this is a refinement case with a lot of missing movement, like it's missing rotation, it's missing expansion, because we don't have the correct amount of attachment and probably the correct shape of the attachments. Because as you see the attachments that there, it's very small attachment. And why we need attachment? Because the shape of the anatomy of the tooth, it's very plain, it's very round. So the aligner doesn't have the way to wrap the tooth correctly and pass the force through that tooth in the correct way. I have 3 examples of attachments, the most used because they are very helpful on the treatment plan. And we are going to see it on a treatment plan to show you how the forces is going to pass through. So if you see the arrow, we are going to start with 2.2. If you see the arrow, and this attachment, it's multi-plane attachment because you can see the shape have like a different type of shapes, and where the arrow is pointed, it's the active surface. So the attachment have 2 parts in all the process. It can change during the treatment plan, but this part is going to be the active surface and the passive surface. The active surface is where the force is going to pass through to make that movement. So if I place an attachment like this, and I place it in that position, I will probably need rotation or a little bit of intrusion. You can see where the force is going to pass through. And the active surface needs to be long enough to receive all that force. As long the active surface is, more stability have in the process, because you have more place to pass the force through. So this is called multi-plane attachment because you can see it have a lot of surface that can be activated during the treatment plan. That means in some point I made the rotation, but I also will need a tip. So the forces is not going to pass through this way anymore. It can change it and pass through another part of the attachment. So that is why there is a multi-plane or multi-surface on this attachment. Then we have the 2.2, the attachment on 2.2. This is a very common attachment, very general. It's a vertical attachment. And it's very helpful when we are doing mesiodistal movement or tip of the tooth. And why is that? Because you can see the active surface is very long in a vertical position. So if you're going to do a mesiodistal movement, you have a good control in both sides, mesio and distal. So avoiding that the roots move or having issues with the root movement, because you have a good control in the crown. So that is very important. And another thing that happens, and why is aligner attachment so important? Because if you move the crown, you need to assure that the root movement, which is very complex. So if you have big attachments or attachments correctly placed, you are assuring also the root movement. Remember, the aligner can cover the crown, but cannot cover the roots. So adding the correct attachment will help you to move the root correctly also. And then we have the 1.1 attachment. It's an extrusion-intrusion attachment. For this type of movement, like extrusion, there is no way we can make extrusion without an attachment. You can see the arrow on 1.1. The extrusion force is vertical. And the anatomy of the tooth don't allow us to pass this force without an attachment. So if you have extrusion, you will need an attachment for sure if you want to achieve the correct movement. Now we have the attachment placement, which is very easy step by step. And for sure, we all as dentists have these materials on the clinic because are very basic, and is first we have the template that is very flexible, and you are going to receive it with the treatment plan. It's where the attachment, you are going to place the bonding to the attachment. Then we have a acid, bonding material, and primer, light. The first tip that I have is always clean your patient teeth very careful, very good, to avoid the attachment drop out during the treatment plan. Then you can fill the template with enough material. Then you prepare the teeth to receive the template with acid, primer, and then cure this primer. After curing everything, you can start putting the template on. And you can see when you put the template on, another thing that you need to be careful is never touch the attachment area. Never create pressure on the attachment when you are placing it. You can pressure the occlusal part or even around the attachment if you feel like to fit it better, but never touch attachment because you're going to deform the attachment. After everything is cured, you need to remove the template. When you are going to remove the template, open the template a little bit because it's flexible because of that, to remove it more carefully. And after you remove it, you can place the light again to cure the rest of the attachment. Now we are going to see a few cases of with the Vision software to review protocols. One is complex case, and the other one is more common case that we are going to take a look. The first one is going to be the complex case. This one is a class 2 case with lower bone condition not ideal, and we are going to improve the canine and molar relationship and also improve the alignment. I'm going to share my screen to show you the treatment plans. Perfect. So this is the first treatment plan that we are going to evaluate. This is the initial position of the treatment. You can see it's class 2 molar relationship, class 2 canine relationship. Same for both sizes, class 2, class 2. We have a larger overjet or increased overjet. In upper arch, we have a very contract arch or very lingualization on the posterior area. On upper, especially on the right side of the patient, we have it the same on lower arch, very contracted here. Crowding on anteriors and crowding on upper also, upper anteriors. And for treat this patient, first we are going to need expansion in both arches because we have even a little bit of cross bite here. On anteriors, the bite is a very edge to edge, and in some parts, it's even an open bite. So we need to expand to improve the patient's bite. This is going to help us even to close the anterior bite. So expansion in both part of the arch and in both arches. Rotation of 6. This is going to open a space to do retraction. Always the derotation of 6 or make it a rotation is going to open a space, especially here, because it's very rotated. When a molar is rotated, it needs more space, right? If we place it in correct position, we are going to win space. And we're for sure going to need distalization. You can see here, at least 3 millimeters of distalization. Here, with just rotation, we can achieve a good relationship because it's not too much distalization needed. This is going to help us to improve the midline, which is not correct, and the overjet is going to be reduced. So let's see first the lower arch, which is the most simple one movement. I want to show you how it was done. First, we are going to expand, right? Especially this area. And contract 7. This is going to help us to expand in a better way when we are contracting and expanding. Contract 7, expand premolars, help us to improve the arch form, but also give stability on the movements. because we are going to create pressure here. And that will make the aligner create more pressure on the premolar sides. So we expand the premolars and contract the seventh. And you can see how there is a space between the molars and premolars during this process to be able to open the spaces correctly. And another thing that I want to show you on the lower arch is something that we call zero tolerance for crowding cases. This is going to be also shown in the next treatment plan, that is a crowding case. But I also did it here because I have crowding in these areas. And to achieve the crowding, I did a zero tolerance protocol for anteriors. So I open the spaces, very careful. And then when I have a better alignment of the teeth, I retract it and close the spaces. What is important here is that when we are open the spaces, they need to be opened, moving the crown buccal, but not the roots. So you see here, there is a torque, but just of the crown, not the roots, to avoid affect the roots and the bone. And when the spaces are done in better alignment, we can retract the crowns again, not moving the roots. The roots need to stay in the same position unless we need to move it for alignment. But in this case, it was not needed, especially because the bone condition of the patient. Need to be very careful on that. And then we have the upper arch. The upper arch is also more specific staging. Let me just reshort it. So for the staging of the lower arch, which is more complex, in the first step, because we have a very trapped molar here, I'm going to show you just this quadrant, first quadrant. So you can see the first step is going to expand premolars, but in this one, I'm going to do a mesial out rotation, leaving this part of the roots or this part of the crown also in the same position. This is going to give me a more anchorage to make this rotation. So I'm going to move mesial out first. You can see there, the mesial out. This part remains in the same position. I'm doing expansion also in 7 and premolars when I'm doing the mesial out. Mesial out, mesial out. And then when the mesial out is done, where I want to have it, I am going to start, which is in this point here. I am going to start with the distal part going in. To achieve anchorage on the mesial part, I'm going to start moving the distal part in. You can see there. And the rotation, which is complex because it's a lot of rotation, is done in more predictable way. Also, important thing with the rotation part, it's open spaces around the molar to allow the aligner wrap as much as possible the crown and achieve the correct rotation. If we don't have spaces, this rotation will probably not be achieved, at least not completely, because we will need space to make the rotation happen, and also divide the rotation into phases. First distal out, mesial out, and then distal in. Now I want to show you the second quadrant. The second quadrant was done. Oh, sorry, in this part of the rotation, I want to stop there and show you the attachment. Because it's very important that you can see, this is the multiplane attachment. And you can see that the force that I'm going to pass through is going in this direction. So I need an attachment here to assist me with the rotation. Because just to create pressure, remember the aligner push, just to create pressure here is not going to be enough to have this big rotation. So I started doing the rotation and passing the force here to make the distal out movement. You can see this is the active surface at this moment of the attachment, and making the mesial part going out. Also, the aligner is going to create pressure, but also here is going to create the forces. That is why attachments are so important, because if we create pressure here, we will need to create pressure also in this part. And then at that moment that the mesial out is done, the attachment can have another surface of active surface to create pressure for the distal in. You can see there. So that is why I use, in these complex cases, multi-plane attachment. Now we can see this side, which have a different protocol, because in this side, I'm going to make not just the rotation of 6, but also distalization. And when we have this type of situation where the distalization is too big, I like to divide the movement, not make it all at once. So you can see first expansion, and the 7 start doing distalization, you can see, and 6 is doing the rotation. We are not distalizing all this quadrant at once. We are opening spaces between the teeth, but the only one that is doing distalization is 7 at this moment. To have a better anchorage, because remember, we are going to do more than 1 millimeter of distalization. This, to keep it predictable, we will need to open a space. Then when the distalization of 7 is halfway, we can start moving 6. And also rotation of 6 is done. We can start distalizing 6. And then when we have almost done with 7, halfway of 6, we can start moving the premolars distal to have a sequential distalization. What happened with anteriors? Well, anteriors, it's important to understand that the patient, this is the things that the patients see. They don't see posteriors, bite, they feel the change, but they cannot see, there is open spaces in posterior area, but they don't feel like something is happening. So it's very important to start with something that we call aesthetic start, trying to improve the alignment on anterior a little in the first step, so they can see results from the beginning and engage to the treatment plan from the beginning. So you can see here the attachment for the posterior area, a very vertical attachment to receive the movement and to make the distalization more predictable. The aligner will wrap all this, all the crown, in here, the mesial part of the crown also, and make the distalization. And we have the aligners attachments or anteriors, which is the extrusion attachment to bring a stability of this area and create the extrusion at that moment. Remember, the force is going to pass through this way, so we need to make the extrusion here. Now I'm going to show you the second plan, but I'm going to show you the initial and final position of this one. So this is the final position. We improve the midline, we improve canine and molar relationship in both sizes. And this is nice to see, but how this can happen is with the step-by-step. It's with the distalization protocol, expansion protocols that we place on this treatment plan. Now I'm going to show you the second treatment, which is a lower only case. It's more simple, but it have the complexity of treat lower only is the fact that we cannot expand too much because we have the upper arch, like creating a barrier, or we cannot try to expand more than this. So in this type of cases that it's very crowded at the beginning, let me show you. It's very crowded. We need to use like this one, this 31 as a guide of expansion. You can see it's no more expansion than these two lower anteriors are, the initial position. So we need to make this fit into the arch form based on this lower anteriors position. In how we can make that, in how we can make it happen because it's very crowded. First, use IPR. The thing is, this vision software allow us to divide the IPR as we need it. Because if you ask me, we cannot make IPR on anteriors from the beginning because it's very crowded. How we can place the IPR tool here and reduce that interproximal contact if we don't have contact. So first we are going to do IPR between premolars and molar in canine because here we have a correct contact. So we started with that from the beginning. Here you can see it is starting there. And do expansion, we move distally these ones to make expansion. This is a protocol that we saw in the last treatment, that is a zero tolerance protocol. So we open the spaces around the teeth with expansion. And when we have a better alignment, like this in here between centrals, in canine and laterals, it's better aligned. We open the spaces to make the IPR. So in that moment, let me just show you the separation. You can see here. I'm going to get closer. You can see from aligner number 10, you're going to see the reduction here. So at that moment, we can have that reduction on this contact. This one is still very difficult to achieve. So we are going to wait a couple more of alignments to do the reduction. Now we have a better position here, so we can make the reduction here. You can see it there. And now we don't have like any undesired contact. We open spaces and we relieve or we solve this crowding, doing expansion, IPR, open spaces, and then retraction to finish with the correct alignment. This is the final position, and you can see that. Now we are going to stop sharing, and you can continue sharing, Rosa. Thank you so much.
All right. Thanks for that, Dr. Tania. That was very insightful. It was very nice to be able to see how you would solve for a complex and a more basic case, crowding in class 2, and how vision enables that for you. And it's very clear that vision's got lots of tools that you can use to leverage that can empower you to make the changes and movements to a patient's treatment. Now, we obviously were not able to show our audience in depth the view of all the awesome different features of the platform, but if you guys are interested, you can quickly get going by visiting our website at dentalaccess.com/product/SoftSmileVision. But we're going to carry on now, and we're going to start talking about AI. Now, over the last few years, and especially after COVID, the topic of talent shortages have been high on a lot of people's radar. Firstly, for orthodontists and for dentists, or even labs, your key goal is to see, treat, and manufacture. You have your processes, and one of the challenges associated to doing more of this stuff yourself in-house is training and retaining staff, of course. Now, luckily for us, AI is rapidly emerging, and I am so excited to explore the the impacts of AI technologies in different treatment planning and leveraging the power of AI to streamline retainer designs. Let's first discuss how AI enhances treatment planning in Dr. Tania's workflow. Dr. Tania was showing a version of Vision that we're currently using. However, there's a new one coming out in the next month. And within this platform, in the new update, you'll be able to have assistance in segmentation. There's going to be the ability to put together a default pattern of where you would place attachments and automatically apply that to arches or to treatments as soon as you receive that in from a patient. There will be a new feature called that can propose the optimal arch forms or have you shift arch forms and then have the teeth kind of distribute naturally to that. And then it also currently facilitates automated stepping. That's just one in a few features that the platform has for you. But the AI-driven features will save time in your process in planning and for Dr. Tania as well, but also improve the precision and efficiency in treatment planning. Now, one remarkable application of AI is in retainer designs, and I know one of our audience actually uses it at the moment. But by simply uploading a dental scan into Xflow within minutes, this AI algorithm will perform a range of tasks. So you can remove your brackets within minutes. You can base a model for 3D printing, also based on your attributes and what kind of settings you'd like to place on the model itself. So you can choose whether you want to hollow it, you want to keep it solid, you want a full palette, and so on. And you can generate trim paths for those that have a laser aligner cutter. And this creates more standardized, precise, and consistent results for all your designs and manufacturing. Now, this streamlined process significantly accelerates retainer fabrication and ensures consistency. The utilization of AI in treatment planning offers unparalleled benefits, as you can see. It empowers dental professionals to optimize workflows, minimize manual interventions, and achieve superior treatment outcomes. With AI, we can deliver more personalized care, enhance patient experiences, and navigate complex cases with confidence. Now, for those that are interested, you can trial out Vision and also test out the AI yourself. Okay, so we've spoken about treatment planning, but also an efficient workflow process is crucial for a thriving practice and for labs. It's essential for maximizing productivity, optimizing resource allocation and utilization, and delivering high quality dental care in a timely manner. Maintaining seamless communication between practice and lab is essential. And so let's explore how Xflow revolutionizes practice to lab communication, streamlines workflows, and enhances collaboration. Okay, so we have the clear aligner workflow, and if you have worked through this, you would know that it starts with scanning. And here, Xflow connects directly with scanners. Now, it directly integrates, it allows for easy capture of all your patient scan files and photos, and then storage of digital impressions and patient data on the cloud. And this ensures accessibility and security while enabling real-time collaboration with those files. With Xflow, you can send some of these scan files out for planning as you wish. And whether it be an outsourcing planning service like what Dr. Tania offers, or the AI service for retainer designs, or if you choose to design yourself using Vision, this integration accelerates the treatment planning process, optimizing efficiency and accuracy and having everything in one place. Now, once your planning process has been completed and the case has been approved, Xflow facilitates a seamless review cycle, allowing practitioners to view, approve, track the progress efficiently across the cases and orders. Now, after you've approved your case, Xflow then allows you to store all those design files securely, providing a centralized repository for easy access and management under one patient record. And then from there, you have the ability to send out your files, these production files, to a third-party lab to design for you, or you can design yourself with our integrations within the platform. So the whole entire production workflow from design approval to 3D printing and cutting is all seamless, and it connects directly to the manufacturing equipment to streamline these production tasks and ensuring traceability in your processes. Once you have your aligners and the retainers, Xflow enables you to input the tracking details so that your client can have the visibility over the items that are on its way. But as you can see, and in a nutshell, ultimately, Xflow serves as a comprehensive communication hub, enabling practitioners to interact with labs and manage their production processes seamlessly. And by consolidating all the communication, the design-related activities in one location, and then be able to move all those files to manufacturing seamlessly, it enhances client engagement and satisfaction. Again, we have a 30 days free trial for those who are interested in trialing, or an online portal. So feel free to jump onto our website, go to www.dentalaccess.com/take control to get started. Okay, so now we have a bit of time to open up the floor for questions. I see some questions coming through already. If you haven't already done so and you are interested in asking any other questions, whether it be treatment planning, AI solutions, or workflow optimizations, feel free to jump into the Q&A, send it through, or in the chat as well. We'll be monitoring that. I'm going to go ahead and answer some questions. We have a question here, Dr. Tania, around treatment planning. So what information do you require to best help you design cases?
Thank you so much. That is a really good question, because the communication is the key to have a successful treatment plan, and at the end to have what you desire to achieve your treatment goals, desires from the beginning. So good information will be, what is your patient's goals on this treatment plan, what they want to see. For example, the main reason of my patient is close the gaps, or improve the alignment on this area, or improve the biting. And then when we have the treatment plan goals, what we want to see on this treatment plan at the end, how we want to see it, how we want to achieve it. If you have a specific protocol to do that crowding, to do that distalization, or to improve that open bite, write it down, like I want to do it with IPR, distalization protocol of this way, ABC, and all the steps that you want to see on the treatment plan. Also, if you have a specific attachments that you want to see or use on a treatment plan, all the information that you can provide, it's going to help me to get into the correct point from the beginning, because I can provide you with a treatment based on general protocols and guidelines, but maybe you have a protocol yourself that it's working for your patients, and you can provide it to me to give you from the beginning. Or I will probably make IPR to make the treatment plan less complex, but you want to try it with distalization. So if you have all this information from the first round of the treatment, it will be very helpful to provide you and avoid delays and a change request of the treatment plan.
Thanks for that, Dr. Tania. Talking about attachments, I've got a question here where the audience has asked, what happens if my patient does not prefer attachments? It's a really common question, and actually a lot of topics revolve around this actually in the recent days. Do you have any clients that are requesting this, and what do you say to them?
Okay, yeah, that is a very good things to say and mention, because maybe sometimes it's not the doctor, or maybe it's not what we want to provide to the patient, because we need to understand how important the attachments are on a treatment plan. I try to give you some lights about it, but the attachment is a big topic because they are very important and provide you predictability of the case. And what if my patient doesn't want to wear it? What if my patient prefer no attachment? If you ask me, I'm going to provide you a treatment plan without attachment, because we customize our treatment plan based on your needs and based on your desires. However, we need to be clear the fact of this is going to reduce the predictability of the treatment plan like a lot, because as I mentioned, extrusion process, extrusion movement, this cannot be achieved without attachment. So this need to be educated to our patients or our doctors, because we need to advise them. If we want to have amazing results from the beginning, if the patient wants to see movements and results, we need to use attachments sometimes to keep it predictable, to add this surface to make the force pass through. So we need to educate to understand this is the best for the treatment. This is going to make it easier, predictable, and simple, because we don't need to have a refinement because of the lack of attachments or because of the lack of the movements. So this, I think, is need to be have a conversation of educational process with the patient about how important this is.
Do you find, Dr. Tania, that when you follow your protocols and use more attachments in your plans, that the plans that you create have less refinements? What's the success rate usually?
How success the treatment plan is going to be?
Yeah, so you mentioned attachments being enabling a lot of predictability in a plan. Like, do you see that with plans that you do offer and issue attachments, that you see those customers or those patients they less than so come back and are happy with the treatment and don't have refinements?
Yes, and you can see the movement. It's achieved more easy. I mean, when we don't have attachment, in some point the attachments were not too popular, and you will see the rate of refinements were very high, in the lack of tracking, and the patient start feeling disappointed about about aligners, and also the doctors. And because of the attachment seems to see so important, in general, all the orthodontics start using attachment and start seeing how the rate of refinement reduced a lot. And this is also creating more confidence to the patient. Like the patient starts seeing results and say, wow, this is working. I'm seeing the results. I don't need refinements. I'm trust my doctor more because of this, because I'm feeling more confident with how my smile is looking. So this is like for all of us as a doctor and patients, this is something that need to be understood. If you have a correct attachment and correct amount of attachments, you will have more successful treatment plans. This in combination with another factors, the commitment of the patient is very important also. They need to wear the aligners correctly. The type of movement, like the protocols that we see, it's also very important, because the attachments can be there, but if we don't have the correct movement, this is another issue. Or if the patient doesn't wear the aligners correctly. So this is a combination of factors, but one of the most important factor here is the attachments. We need it for sure.
That's so good. Really good tip for a lot of our audience out there. A lot of audience questioning about a number of attachments you use in your plans, not specifically you, but like a lot of people prefer a lot of people prefer less attachments only because when it comes to manufacturing, they are producing a lot less stages for their users. But in the end, what they end up realizing is that that patient comes back for more refinements in the end. So you got to weigh up what you want and how you want to go about your business. Now, I have another question here from one of our audiences. What type of X-rays would you like? CBCT, is that important? And are pictures helpful for you?
Well, all the information that can be provided, it's great. CBCT is important for, I think, doctor evaluation. In this case, as a set up the designer, set up the design of the case is not to impact because I cannot add the CBCT. But if you as a doctor can review it, it's good because you have a better vision of the bond. So the X-ray is good to evaluate if we have a specific situation happening. But the thing is, the treated doctor need to evaluate all this first. The pictures, otherwise, it's very important because sometimes one of the requests of the doctors sending cases is improve midlines. But if I don't have the picture of the midlines, smile picture, I don't know which one is correct and which one is not. I always going to base that the upper is the correct one. So then I have a change return saying, or change request saying that do not move the lower one, move the upper one. I mean, that is time that we lost in this communication process. So photos are part of the communication if you need something specific. X-ray is also part, but it's more for evaluated by the doctor. If you want to include it, great. You have it on the portal now. You have all the information there. For me, it's like half a database. So you can go again. Dental Access provide you the database so you can go and review all the information of your patient, photos, X-ray, everything. So you can have it there. There is no limitation of that. But for me to create a treatment plan, if you have photos to provide me more information, that is great.
That's great. Okay, I have another question, but before we ask that question, I just want to make a note here that having an audit trail is always so helpful in treatment planning because you never know what's going to happen when a year later the patient comes back and their treatment's not tracking. If you have all this information in several systems and platforms, it's going to be so hard for you to be able to track back at what point did we go wrong in the treatment or what do we miss out on our communication, for example. So that's a really good one to note for a lot of our audience out there.
Yeah.
Now, I have another question here from the audience. I scanned a patient with brackets or bonded retainers. Now, will that case be treatable or do they need to rescan that and send that back?
That's a good one also because we saw on this seminar or webinar that is not an issue with the vision software. Sometimes we receive cases with brackets that the doctor just take the impression because they don't want to lose time. All this situation with clinics and orthodontics and dentists, it's about time. It's about spending less time on the chair. So if we need to remove a bonded retainer, we can do it later, but send the scan now to keep it tracking, to avoid losing time. The thing is, vision allow us to remove these advices like brackets, even attachment that is not good or not tracking, or maybe the patient broke the attachments and need to be replaced, or is a refinement case and you say, okay, evaluate the attachment. If this need to be removed, please remove it and place new ones. That happens a lot. So we can remove them and place new one if that is needed. So the answer is, you don't need to send a new scan. We can treat your patient with the one we have, removing the attachments and scan it attachment, align brackets or bonded retained.
also a really good tip for those that are looking at designing themselves using vision as well, right?
Yeah.
Okay, so another question. Which trim line is best when you're producing aligners for patients? So do you think scalloped is better, or do you think straight is better? There's usually two camps there.
That is a really good question, because recently there is a lot of studies about trimline. They have been found that the trimline can bring a lot of benefits, how long the aligner is, and also what is happening if the aligner not fit correctly. Sometimes it's about the trimline situation, the cut of the aligner. So what the recent study says, if the aligner is longer, the stability of the aligner is going to be better. However, if we have a very crowded areas, the scalloped cut of the liner is going to fit better and even be more comfortable to the patient. So what is my recommendation in these situations? The thing is, vision allow us to create complex streamline cuts, like a combination of the streamline cuts. We don't have to select just straight, a scalloped, or something like that. One of them. We can combine it. We can even change it during the treatment plan, because maybe we solve the crowding, as we see on the treatment. We solve the crowding, and at that point, I want the aligner be longer. We can do that. That is something that is really good about this vision software, because allow us to change the trimline where we need to and in the places that we need to. So if we have a very crowded case, but we don't want to lose the stability of the aligners, we want they fit tight and good, so we can make it longer and straight on the posterior area and scallop it on the anterior area to avoid create like discomfort to the patient, and make them fit better and make it easy for the patient taking in and out. So that combination is going to be a good option. Also, if you have a lack of anchorage because your patient doesn't have a molar, for example, in that case, you can do straight cut for all the aligner and longer to have better stability. That will depend on the case to evaluate first.
I'm seeing a theme in a lot of the answers that you provide. I think the key point that I've seen so far is that, like, every patient is very different, and there is no one way of applying any kind of protocol to each of these treatments that you do. And
Yeah.
I've just got another question around attachments. So have you found having a lot of attachments makes it difficult for the patient to insert the aligner?
No, I didn't find that this is depend on what type of situation is happening with the case. Let's say we have a very crowded case. In those situations, the attachment need to be smaller, because the crown or the size where we can place the crown is smaller and make the attachments more difficult to get in and out. But this with time is going to be more easier for the patient after the aligners create the movement or make the expansion. That is why I always start with expansion in all the cases, because it's going to make it easier for everyone. So the thing is not the attachment. The situation is how the treatment plan is starting, with a lot of crowding, with a lot of compression on the posterior area. So I think it's a combination of having the correct trimline, having the correct size of attachment. It's not probably the amount of attachments, it's probably more about the size of the attachment. Yeah, I think as Rosa mentioned, need to be evaluated individually. Not all the patients work the same. But if you have a case where it's very crowded and you need attachments because you are going to do extrusion process or very rotated tooth that need to be done, request smaller attachments, or when you are seeing and reviewing the case, say, okay, I feel this attachment needs to be, it's going to create discomfort, and also request streamline that allow you to make the insertion more easy, like a scalloped trimline cut, for example.
Another question here around the number of stages. So what if I don't want as many aligners in my treatment plan, or at least my patients? I think is what they're talking about.
That is another good one, because in some cases they just want to reduce the amount of treatment plan, because trying to reduce the aligners, that means we are going to make the treatment plan shorter. The thing is, when we are trying to reduce the amount of aligners, we will not have an ideal end result, because we are going to reduce the time that this patient is going to wear the treatment plan, right? So if we try to reduce it, we need to take in mind this is going to reduce the movement that we can achieve. Remember the forces that we show on the presentation? So it's the same. If we have a rotation of 10 degrees and we can only have, remember, it's only 1-2 degrees by aligner. That is the only one we can achieve by aligner. If we have 10 degrees, but we want 3 aligners, those 10 degrees of rotations cannot be achieved. So we need to take that in mind when we are requesting reduced treatment plan. That can be done, but the end results or the final position of the teeth is going to change. It's going to not be ideal. When I have a treatment plan, I always try to make it ideal unless they request something different. Let's say I have been receiving treatment that say, please only align anteriors, or please improve only this or that. But if I don't have any instruction, even if this is a refinement case, I try to make it ideal, because I want to keep the quality in making as better as possible for the patient, right? But if you request, I don't want ideal, I want just improve this and that, that is possible also. That can be done, but you need to understand we will change the final position, probably not achieve all that need to be done on that treatment plan, reducing the number of aligners.
I guess in that case, with a lot of practitioners, would your advice be just making sure that our clients and our patients have that conversation to manage expectations, that if you want to have a shorter plan, then there is going to be some refinements required, or you're not going to get the outcome that you want?
Exactly.
Okay, so question on your service. So can your service accommodate special treatment planning requests and complex cases? And it seems like you can.
Yeah, it is. I think the main situation, because it is the software allowing us. The thing is, Vision have a lot of tools that give me the chance to treat complex cases, because as I mentioned, I have been treating and working with several softwares, and we can have amazing final results, like ending the treatment very good. But if the software don't give you the chance to have a good stepping, for example, like the step-by-step, showing the numbers, showing and play around with this and make it separate movement and change the aligner shape, this is going to be very difficult to achieve complex cases and provide you predictability. I think Vision gives us the chance to treat these cases, not just treat it with a good predictability, with a good step-by-step, to allow us to provide amazing results. And let me feel comfortable with the fact that what I'm doing at the end, it's going to happen, because I can see all the steps and all the tools, the attachments that we have. So yes, the response is yes, we can treat complex cases, not just to give you a final result, a correct final result, to give you a step-by-step correctly done with good protocols to give you an amazing and predictable results.
How do you ensure quality assurance in your treatment planning process?
I basically follow the guidelines and protocols regarding clearaligners therapy. I have been able to understand better how they work. But I also follow your instructions. That means if you provide me the correct information, if you provide me even your own protocols that you use to solve some situation, I will follow your instructions. That is part of the quality, but also if you don't provide or you want to try on to see how to close that gap or how to close that open bite or do the distalization, I will provide you with protocols that has been via study and has been worked, not just for me, my patient, but also for patients around the world. So that is how we treat it. I always treat the case as this is my patient and I want the best quality of it. But also I follow everything that you want me to follow, all the instructions, protocols, everything, because we customize our treatment plan. It's not just one way to do it. There is a lot of way to do it. So we need to customize, and all the patients have different needs. So we need to review very carefully from the beginning what is going to happen and how we are going to solve it. And see all, as we saw on the presentation, see all around the patient and customize the treatment plan based on that.
And how would you handle revisions and modifications to treatment plans during this process, Tania?
The modifications comes, and one of the things that I really like about Dental Access portal is that I have all the information in one side. So I don't receive like an email. If I do, I take a look, but if we have it in one place, it's going to be easier. So the modifications that we receive, we have the information in the portal and we can take a look. I can review all the notes. I always like to do this. I review the modification, but I also go and review the first requested to see if there is not something that I'm missing there. I can take a look on the photos if that is needed and if I have it. And make the modification based on your request, on what do you need for this patient to be changed. Some of the common modification is like, okay, but I want to improve the midline, not with distalization, with IPR. So I can go there and tell you, okay, IPR was needed on this and that contact, and provide you with also information in the same place. So we have like a chat channel there with a good communication. So that is how we handle the modification.
All right, thank you, Tania. That was very insightful. A lot of really good questions being asked and very insightful answers provided. But we're going to keep moving now. For those looking to implement these strategies and technologies into their practices, here are the next steps for you. So if you're interested, feel free to explore further by visiting our website at www.dentalaccess.com/products. And then feel free to consider incorporating Xflow in-house designing with vision or outsourcing it to either an AI for retainers or Tania for aligners. And feel free to contact us for a consultation, booking a demo with us. We can run through all of it with you. I can even get Dr. Tania along and we can have that conversation. But all in all, thank you to all our participants today for joining us in this insightful discussion. Your commitment towards advancing dental care through innovation and innovative technology is commendable. We encourage you to stay connected and continue your learning journey with us. So here on the screen, you see all the upcoming webinar series that we're planning. We're going to be starting off, probably going to be kicking off with a more deep dive into more treatment planning with Dr. Tania. That's coming at the end of May, and there's going to be a link coming up on our events page at Dental Access for pre-registrations, and also we want to make sure that the webinar fits your needs. So come in, register for that, make a comment around what you would like to see. And depending on what we see as results, we will cater it to your needs. Secondly, we have one with a leading orthodontist who's going to talk about how he's used our direct integration into the scanners to ensure that he navigates privacy in his patient treatment, how he manages all that information on the cloud, in his practice, in his lab, and any insights and strategies that he may have. And then lastly, we're going to be talking through the manufacturing workflow, which will sum up this whole workflow series. And it's going to be focusing on how you scale up, how you cut costs with technology, how do you optimize things like thermoforming, 3D printing, laser liner cutting with a little bit of automation, and then also the type of materials you may be interested in looking into. So without further ado, I think together we can leverage cutting-edge technologies and collaborative approaches to elevate dental care standards and enhance patient experiences. So thank you once again, everyone, for being part of today's webinar.